Welcome back. Our docs are answering your medical questions. If you have one, email us at greatdayhouston@khou.com. The largest organ we have is our skin, and it takes a lot of abuse. Whether you're looking to get rid of scars, wrinkles, dark spots, or sagging skin, my next guest can take care of those problems with procedures that take less than an hour. From the Institute of Anti-Aging, please welcome back Dr. Richard Laconi, Clinic Director Dana Laconi, and patient Susan Hinds. Hi. Okay, Susan, were you one of those sun worshipers trying to get your tan on?
I did a little. I did a few things I probably shouldn't have done over the years, and then I decided one day, you know, it's time to turn back the clock a little bit.
Yeah. What was the moment? Did you kind of look in the mirror and had a certain outfit on and just went, no?
You know, part of it was I had large pores that I really didn't like very much, and I had a few sunspots, and I just decided it's time to do something a little more drastic.
Yeah, it sneaks up on you.
It does.
You know, now, of course, the thing that we should all do, Dr. Laconi, is not get overexposure to the sun, but the song that's coming to mind me right now is Too Much, Too Little, Too Late, right?
Yeah, it's the sun that, you know, from 10 years ago that's now coming to bear
10, 20, 30 years ago that's coming to haunt us.
Right.
But the good thing is that technology has caught up. Okay, she talked about a couple of things, having kind of the sunspots, the large pores. Before, there's different ways that we would deal with it that were much more aggressive, but you have a wide range of things that you can do now.
Surely, yeah, there's a wide range of things. What we're featuring today is really, I'd say, probably the end point, you know, the most effective tool, but certainly home care. Things like Obagi care with
I love this
using
line. This is what I use. Love this line.
And some of the agents to help kind of remove the dark spots. But to focus on the laser, this is a modern, tamed version, if you will, of a laser that's been around for almost 40 years. And, you know, people have heard stories about the old style laser where you had to, you know, stay in for 2 weeks and have, you know, a burn specialist take care of you. Those days are gone.
Okay.
This laser is so much more user-friendly and friendly on the patient.
So laser skin resurfacing is what we call it, right?
Right, correct.
Okay. And the goal is to replace damaged skin with new, fresh skin. So kind of getting to those layers that haven't come out yet.
You know, and it does that. It replaces it with new, fresh skin, but it also gets below the skin layer to stimulate your skin's ability to rebuild itself. So it uses these little laser stimuli that then over a period of about 6 to 10 weeks cause the skin to contract, cause the pores to contract in size, fill the fine lines with collagen. So this really just tells your skin to wake up and do its thing, repair itself.
Yeah, we're looking at that video of it being done, because when you say laser, people think you're like frying the skin, those lasers of yesteryear.
Right.
And you are to some degree at lifting it off, but how did it feel when you're actually having it done?
You know, you really didn't feel very much at all. Occasionally you'd feel just a little zap, but really in looking back, you don't remember any of it.
You were thinking, zap, wrinkle be gone.
Okay,
Wrinkle be gone.
I'm going to be a whole new person when this is over. Bring it on.
Let's take a look at some pictures while we're talking about this, kind of that before and after. And Dana, even for you, you think that if you look, when you compare pictures of you 10 years ago, you compare pictures of you 10 years ago.
Better now. I think I look younger now, and it's amazing when I go back and look at those pictures. I had really bad sun damage, large pores, loss of volume. And that's really the reason why we got into this business. These are things that I needed, and I really do. Looking at the comparison of my photos, it's just amazing.
Yeah, so Active FX. Okay, so that we saw a picture in between there. Can we back up on that one, Justin? Back up. Okay, so we back up. Look, there's how fresh the face is. Now, this is about as bad as it gets, right? Yeah. So you were indoors for a couple of days.
Oh, I occasionally went to the grocery store, and I just figured, you know, people look, but I don't know them. I'll never see them again, so that's okay.
So you might want to take a couple of days off.
Much better.
Right. Well, there's no pain. I mean, she could work around the house, and by day 5, she was back at work and just looked, you know, red.
Yeah, yeah. Okay, I want to see some pictures of Dana if we could.
No.
And what all have you had done, Dana?
A little bit of everything. I've had Microneedling, Photofacial, Active FX, and then I just do regular skincare maintenance. I really don't do much anymore.
Yeah, once you get your fresh layer of skin, you get a second chance. You want to take care of that skin. All right, then there's Deep FS. Is that different?
Deep FX and Active FX are basically versions of the same machine. For instance, that's the Active FX treatment head right here. The Deep FX machine head looks slightly different, but it generates a slightly different beam size. So the Deep FX is more for getting to the deep collagen problems like acne scars, deep wrinkles, pore size, just refining the texture. And then the Active FX, this one, uses a slightly different beam for going at the surface irregularities, the brown spots, and tonal irregularities.
Once that's all gone, if you take care of your skin, does your skin stay good?
Yeah, you know, this is a permanent treatment for all practical purposes. I mean, you know, skin damage and sun damage do go on, and the aging process does go on. But this is considered a permanent treatment. It's not considered to have a 6 months lifetime or a 1 year lifetime. Truly, I do recommend that people do it, you know, periodically to kind of keep up. With
I'm doing it once a year just to kind of maintain the collagen and skin tightness.
Response.
And then combined with this can be things like the Botox to stop the wrinkles from forming, and different types of injections to pump things up.
And I think it's amazing. Like, we're both 48, and I don't feel like I look 48. In fact, I love my skin. And a lot of women our age.
Well, you look fantastic. Dr. Lacconi has a special offer for our Great Day Houston audience. You can get 25% off all skin tightening lasers and hair removal lasers. Hair removal, too. Look at that. Because, you know, when you get a little bit older, hair starts coming out places. You're like, what is that? Girl, where did you come from? All right, well, the number is 713-807-1000, 713-807-1000, and you can view all the anti-aging specials on their website, antiageinstitute.com. After the break, for many patients, amputation of a limb has been necessary to save their life. But a new method in Houston means more people are able to avoid amputation. We'll tell you how next.